Okay, we're going to do tracheostomy care. Our fellow has humidified oxygen. Certainly it wouldn't be per this mask, but that's the only thing we have to simulate it with. It would be made to go over a trach. But the first thing we want to do is auscultate lung sounds, assess whether or not he needs to be suctioned. And if he needs to be suctioned, I would prepare my materials that I might need. I have my ambu bag, I have my suction kit, and let's see, a red bag. Okay, so the first thing I want to do is put on some clean gloves and remove my old dressing. Just go ahead and get that out of the way. As I remove it, I want to assess the amount, color, consistency of the drainage, and then I will trash that into my red bag. I will then open my suction kit. This is one that comes with the water and everything right in it. I'll go ahead and put on some sterile gloves. And I also want to hyperoxygenate my patient. Let me... Alright, so I have an ambu bag available. I will remove his oxygen and attach the ambu and give him some breaths. Alrighty. Which, I don't know, they supply you with sterile gloves, but honestly, it's not a sterile procedure. And okay, I'm going to open my water here. Got my suction, because at this point, honestly, I would need to oxygenate my patient again. Connect my suction, and then what I'm going to do then, hyperoxygenate the patient, and then I don't know if this will go down, and then I will go down until I meet resistance or the patient starts coughing. At that point, I will then occlude my suction catheter, twisting it side to side. As I pull it out, the patient will be coughing. And alright, so then I want to cleanse my tube by suctioning up with some water. I may need to reassess, I may need to do it again. Alright, so I then again may need to hyperoxygenate and reapply my humidified oxygen while I prepare for the trach dressing change. Okay, back to trach care dressing changes. I have a drape here that I'm going to pick up by the corners and hold it up in the air, get away from my sterile field, lay it over my patient so that I don't get my patient messy. It might be that I have a package of sterile gloves. In this case, I've put my gloves into my container because many containers, trach care dressing kits, come with the gloves in them. So this has an extra drape for a sterile field. I'm again doing my own camera stuff here, so please excuse me. But so I'm gonna, this is plastic side up, so it really doesn't matter where I touch it because I know that the plastic side is the bottom side. I'm going to pick it up and whoa, I'm going to lay this down as my sterile field. At this point, I can choose to put my gloves on because they're next. It might be that you might take your container and dump it out on your sterile field, but you don't have much control in that way, so I might choose not to. I would want to take the lid off of my containers. I've got extra stuff on here. Again, I'm not reaching over my sterile field. So I've got my lid off of there. Let's say that I'm going to put my gloves on. I picked it up by the cuff. Gosh, okay. I'm going to put one glove on. Of course, it's caught on my ring, and then I can pick everything up and have control, lay it down neatly as I want to on my sterile field, so that I do have 3 empty containers here. I'm going to pour half and half in 2 of my containers, half peroxide, and if I have trouble reaching anything, then certainly I can move my over the bed table. So I'm going to pour half into 2 of the containers and then complete normal saline into the other one. Okay. I still got my gloves on. I'm going to go ahead and put the caps back on this because I don't prefer to have them sitting open for a long period of time. I can tighten them down good later, but that is good for now. Okay, so then I'm going to put my other glove on. Okay, all right. First thing I want to do is to remove my dressing. Let me see. Excuse me. Remove my inner cannula. I will secure the faceplate, twist it. It should come out at 6 o'clock, and then kind of you can turn it to 9 o'clock if you need to. That's more if you're putting it in. Start it at 9 and then turn it to 6. So I'm going to put it in there and let it soak for a few minutes. I'm going to then take my swabs. I may put half of them into my half and half and half of them into my saline. I'm not going to put anything else in there with the inner cannula because usually it has, it has a lot of drainage on it and a lot of stuff floating in the water, so I prefer not to do that. I may want to take a 4x4, fold it, dip it in my half and half, and then cleanse with that. Let me see if I can move this around here and make this work. Okay. Again, I'm going to secure the faceplate. Maybe I need to cleanse around the side. I'm going to use a different area of my cloth and cleanse, and then drop that into the biohazard bag. I'm going to take my half and half, and I'm going to get behind the faceplate, one swipe around it, take another one, go behind the faceplate, one swipe around it. One thing you may consider is that you have, if this is a new trach, basically you've got a new incision under there. You don't want to contaminate your new incision. Also then, remember that once you've cleansed with the half and half, that the peroxide is irritating to the skin, so certainly you want to completely cleanse away that half and half. So then I'm going to take saline soap swabs and repeat the process. Going under here, one side, pitch it, another one, and pitch it, okay, and another one. I may need to cleanse some around the front, whatever, until I'm clean, and then I may take a dry 4x4 again and remove the moisture. I have plenty, so I then may need to go to the back. Again, I'm being cautious around my new incision. One side, pitch it, and then the other. All right, so I want to then cleanse my inner cannula. I have a little brush here. I'm going to hold to the outer edge of it, scrub it off. May need to dip it again. Go inside, although this brush doesn't fit this cannula too well. You can also use the pipe cleaners. Sometimes you might need to bend them in half to get a little better cleansing. Just kind of depends. But most of the time, let's don't bend our things up like that. We'll just pretend we're doing an excellent job here. All right. So we cleanse them really good. Then drop it into the saline. And then what we want to do is tap it off. Make sure you've got the excess water off of it. And if you've got another pipe cleaner, you might go down the inside of it with the dry one in order to make sure the outside of it's dry. Then I can go ahead and replace it. Again, I'm going to go in at the 9 o'clock position, secure the faceplate, turn it to the 6, and then turn it till it clicks once you've got it in place. Then the last thing that you want to do then, no, excuse me, I left out a step. I forgot my dressing. I want to go ahead and apply my dressing. Again, I certainly don't have sterile hands at this point, but and I am going to just put this into place, but I'm going to try not to contaminate any more than I have to this inner edge of the dressing. And certainly you always want to use a commercially prepared drain sponge so that you haven't gotten cut edges, so that you could get pieces of frayed material into the wound, into the trach. I have this nice sterile area, so I don't feel bad about laying it down here. And I need to work it in. I might say, "Sir, can you raise your chin, please?" But he's not responsive. So anyway. And I pull his dressing here in place. Okay. I have my ties, and what I want to do actually is pull my handy little bandage scissors out of my pocket, or not. You will have yours in your pocket, but I'm going to make a little cut on here. My scissors are so nice and sharp too. All right. Now, certainly I do not want to remove the old ties before I put the new ones in place. I want to make sure that they have at least 1 to 2 fingers width of room in between them, and I also want to alternate the tie. I don't want to tie right over the carotid. I want to tie it, you know, to one side or the other, and then again, like I said, alternate that. So I'm going to put my new one in place first. You can use a pair of hemostats then to pull it through. It works much easier. And then when you put it around his neck, try to get it straight so it's not wadded and uncomfortable for him as time passes. I know you're limited on how well you can see, but basically I'm just putting it in through the hole. It doesn't matter if you go in from the back side or in from the front side, whichever you prefer. It doesn't really matter. And then what we want is an easily removable knot. These allow you plenty of room. So a nice little slip knot works really well. So all you have to do is pull with one hand to get them loose. And then once you've got it in place, then you can remove the old tie. Sir, can you lift your head? Thank you very much, sir. All right. So, and then you are ready to go, all with a brand new one. All right, another way you can do this is to put it through. Wait, let me start on the other side so you can see what I'm doing. I'm sorry. Awkward for me. Okay. Pull them both through. Have one a little longer than the other one. Pull them around double, and again have it very straight. Then take the longer one and put it through. And then you need one just a little bit longer. Bring it back and then make your tie. And that might be a little easier. And I can also tell you that I'm not particular. In some places they tell you to tie a square knot. but certainly that's not so easily removable as one that you pull a loop through it, and if you have more room, make a loop. But as far as check-off purposes, if you tell me and show me either way, I'm good with it. If you don't have enough room to make that nice loop, if you tell me that that's what you would have done, I'm good with that too. So you might like the double method better than the single method, but you know, either way is correct. You may want to pad his chest with a towel. Say that the kit that you have has only one sterile drape in it, then I need that sterile drape then to put my supplies out on. So I'm going to pad his chest then at that point with the towel. And it's going to make a difference if my gloves come in the kit or if I have to add them to it. I know that if I have gloves in a sterile package, I can use that sterile package for a sterile field. So I can kind of improvise according to whatever kind of equipment that I have. Again, you need to remember that when you're working with a sterile field, you're not going to cross your sterile field. You need to know how to put your gloves on correctly. Do you need to take your supplies and dump them out on your sterile field? Again, if I did that, I could not touch my sterile field if I decided to dump them. And then I have the concern, if I'm dumping them, are they going to fly over to the edge where I've only got the 1-inch barrier all the way around? I kind of like the method of putting on one glove and then I can reach in and get them out. And then with my ungloved hand, then I can pour my liquids. So, you know, again, whichever you prefer, but you're always keeping in mind your sterile principles so that you can follow them. All right, good luck with your practices, and thank you.